irony of recognizing that stressors bring out psoriasis is that psoriasis can also then make people feel stressed. And so the question is, how do you break that cycle? I'm Sarika Ramachandran, and I'm a board-certified dermatologist. Today, we're going to talk about psoriasis and stress. So, can psoriasis be impacted by our stress levels? Yes, stress can bring on flares of our psoriasis and our psoriatic arthritis. I don't know that we know all of the reasons. We know that, stress can alter certain hormone levels and other physiologic changes, and those may be at play here when it comes to stress, but they've looked at studies and seen that stressors in life can trigger psoriatic flares. Recognizing that stress may be kind of worsening psoriasis can help us to think about ways that we can kind of decrease that stress. In terms of stress reduction, there's no one answer that's perfect for everyone. Take some time to think about the things that help you feel better. Whether it's talking to a friend, joining a support group, doing yoga or meditation, engage with the world. Don't let the psoriasis stop you from being with others. Sometimes getting on top of treating the psoriasis and trying to help that as much as you can, that may be one way to try to reduce that cycle or alleviate the kind of psoriasis stress cycle. Other things that can be helpful are taking care of the rest of your health. So making sure that having a healthy diet, having, exercise and movement involved, especially knowing what limits are in terms of psoriatic arthritis, all of those things can kind of play into reducing stress. One of the other things is if you know what are some of the triggers and say there's a stressful event coming up or something that's going to happen in the near future that you kind of know about, then sometimes kind of being more diligent about your psoriatic care can be helpful, and that may help to cut down a little bit in terms of flare. You can't always predict the stressors that are going to happen in life, and so you do the best you can, and for those things that you can recognize ahead of time, you try to account for them and you try to get ahead of them, but we know that we can't always predict these things. There are many skin diseases that can affect us beyond just what the skin looks like. In the case of psoriasis, we can see associations with anxiety, depression, and it can be helpful to have a mental health provider on board. If you're struggling with mental health issues and you have psoriasis, it's very important that you seek help. You reach out to your loved ones, your mental health providers, your primary care physician, the other physicians that are working with you. I would encourage people to reach out to find out more about support groups, being in touch with people that may be going through similar things. Sometimes it's helpful to hear about options that people have pursued for treatment, but also some of the feelings that they've gone through and some of the issues that they've dealt with as they're navigating their journey in psoriasis and also other skin diseases. Skin disease is different in certain ways from other diseases because you can see it. You can see it on your skin. When you look in the mirror and you look at the reflection of yourself, you're seeing skin disease and how it also is affecting kind of your view of what you're looking like and how you see other people looking at you. And so I think that for people to know that they're not alone in this, for you to know that there are other people with psoriasis that are navigating similar journeys and that there are lots of resources that may help you in navigating your journey as well. Thanks so much for watching. We hope that this was helpful. For resources and links to help navigate stress with psoriasis, please be sure to check the description box below. You are not alone, and for more videos like this from Healthline, be sure to like and subscribe.